My name is Dr. Taylor Walker. I'm a family medicine physician and an abortion provider trained at Cambridge Health Alliance in Boston, Massachusetts. I'm also the national president of the Committee of Interns and Residents, CIR-SEIU, which is the nation's largest physician union, who represents residents and fellows like Dr. Pellis, who you just heard from. So I wanted to share a little bit of my personal story. I grew up in Memphis, Tennessee. That is a state with some of the worst health outcomes in the country. For 7.5 years, I watched my mom battle ALS. Medicare and Medicaid were her lifelines. They provided the care, the equipment, the medications that she needed as her body failed. Her hospice nurses, Gladys and Bird, became part of our family. I lovingly say that I was raised by mom's hospice nurses. They taught me how to fry the perfect over easy egg and how to do the bedside care that I still use today. Mom's Medicare and Medicaid coverage brought Gladys and Bird into our lives, and without them, my family would have been financially devastated on top of losing my mom. Nearly 10 years later, after she passed, I started medical school in Tennessee. Tennessee's decision not to expand Medicaid left me in the coverage gap. I was 26 years old. I was unable to work while studying, but I was also ineligible for assistance or subsidies. So my Medicaid insurance coverage would have cost $800 a month with a $5,000 deductible, which is almost $12,000 out of pocket before insurance covered anything at all. Because of that, I went without health insurance for 5 years while pursuing 2 graduate degrees and preparing to care for our country's most vulnerable population. I know firsthand what it means to make healthcare decisions based on cost rather than on need. As president of CIR-SEIU, I represent over 37,000, not quite 70 yet, residents and fellows nationwide. We are the largest physician union in the country, and we're also the fastest growing healthcare union. We have doubled in size after the start of the COVID-19 pandemic, which laid bare the deep cracks in our healthcare system. We are now in a fight against the corporatization of healthcare, where profits come before patients and workers. CIR members see the union as an avenue for change, fighting to protect Medicaid and the 85 million Americans who rely on it for the dangerous policies pushed by RFK Jr., Dr. Oz, and the Trump administration. You just heard Dr. Pellis say that resident salaries, teaching costs, and training infrastructure all flow through CMS, a fact that few people realize. Budget cuts or privatization threaten not just the current patient care, but also our ability to train the next generation of doctors, deepening the physician shortage as our population ages. Dr. Mehmet Oz's nomination to lead CMS is an existential threat to both Medicare and Medicaid and physician training. His push for Medicare privatization through so-called Medicare Advantage, which you've heard all of us call Medicare Disadvantage, should alarm everyone here. For resident physicians, privatization destabilizes training programs. When profits drive healthcare, teaching hospitals, which care for our most complex patients and operate on very tight margins, become extremely vulnerable. We have already seen hospital closures and residency cuts when private equity enters healthcare. The 37,000 residents and fellows that I represent are deeply concerned that Dr. Oz would accelerate the corporate takeover of Medicare. These young physicians entered medicine to heal, not to fight through insurance barriers designed to maximize denials. Our patients cannot afford to have their health care dictated by shareholders. The most vulnerable should not bear the burden of restrictive networks and coverage denials while corporations post record profits. I urge the Senate Finance Committee to reject Dr. Oz's nomination. The health of millions of Americans and the future of physician training hangs in the balance. Thank you so much.